Keeping things moving, next on our agenda is a business meeting. We're going to do this for the next half hour, try to keep all of you, the members of the organization, informed about how we operate, changes we're making, and how well we're doing. First item of business, however, is Chad. Would you like to come up and accept? We do this so he doesn't have a prepared speech. Your gavel for this year's meeting. I think this has been an incredible meeting. Everybody's had a great time, and we really appreciate you. Just say a word or two. Go right ahead.
Well, I didn't know that I'd have to prepare some remarks, so I'll keep them very brief. I've really enjoyed the opportunity to put this meeting together, and was very surprised about the amount of work that it takes to pull something like this off. I've been to national meetings like many of you have, and I had no idea what goes into planning a meeting of this scale, and really have to thank everybody else that's helped the board and Teresa and everyone else, and all the speakers that have donated their time and their expertise in coming today, and very much appreciate working with all of them, and encourage everybody, since this meeting's been so good, to continue to support the organization going forward. Thanks.
Next item of business. The board of directors meets, we actually meet several times during the year. We have different functions for each of those meetings. Some of those are to plan the next conference. As part of the board, what we do is we have a president-elect. The president is the guy who's doing this year's meeting. Past president's the guy who did last year's meeting, and he kind of helps out the president. And then the president-elect is the person who's going to be doing the next meeting after that. The board, some of our meetings are related to preparing for those conferences. As Heather may or may not mention a little bit, we have to meet certain criteria to get CME credits. Getting CME credits is becoming more and more difficult with more and more requirements and regulations, just like everything else in the world. And then we have a retreat once a year where we get together and talk about the organization, where it's going, what do we need to do to keep this a viable organization, to meet educational needs, but more importantly, to meet our primary goal, which is to get everybody together at least once a year for several days to interact in a way that doesn't occur in very many other communities at all across the country. So this organization is very unique, and that is its primary goal: community involvement, community association, people knowing each other. You call somebody in the middle of the night, you know who that person is, they know who you are, and this becomes a community effort rather than an individual effort. So we have a retreat, and we talk about those things. This year, one of the things that we decided to do, because we're having more past presidents who had the experience of putting these meetings together and what this is all about, as they became the past president, then they basically went off the board and went on with their lives. But many of these people want to stay involved, and so we created like an at-large position on the board so they could continue, but they're not voting members. Another issue that came about was that, as I mentioned, getting CME credits and preparing these meetings is more and more of a task. So we decided that we wanted to add a couple of positions to the board in order to accomplish some of those goals. So in the past, The secretary has been responsible for making sure that all the actions and all the things that we do in this organization are documented correctly, and has done CME, but that's become a big-time job with a committee under it, with some volunteers that have to review all these slides ahead of time. They have just lots of things that they have to do. So we created a position of CME chairman as a separate position on the board. We also needed transition within the leadership role of the chairmanship, and also we needed someone to stay current on, and one of our educational meetings each year is on policy governance. We operate through a mechanism called policy governance, and it's not how other organizations all operate, but someone needs to maintain expertise in that over time to make sure we're working and functioning the way that we should. So we created so we've had a chairman, and now we have a vice chairman who fulfills that role. Then we have a secretary, and then we have the treasurer who takes care of and keeps track of all the money, and you're going to get a report on that in a few minutes. Then we have the president-elect, president, and past president, and those three people just rotate in and rotate out. And then we have 3 trustee positions that have an unlimited number of terms at this point in time. And one of those trustee members is designated the historian. We're very fortunate to have Val Johnson, who's, I don't know how he's been around a long time, he knows all the people in the town, he does all that work, and so it's important to have that person as one of the trustees. So the board has already voted on that and recreated those new positions on the board. So we're up to 11 members of the board, and most studies on functioning and efficiency and things would indicate that's as large as our board should be. But we want to allow some of the people who, we hear from people all the time, they'd like to be more involved, and we try to do that as much as we can, but even though there's a lot to do, there's really only so much to do from a board of directors position. Teresa does all the work. She's phenomenal. I mean, she just puts that all together. And if she needs help, she'll call somebody and ask for it. So our biggest spot where we can use some help and get people involved right now is in CME, and Heather's going to talk about that for just a moment. So that's our new structure of the board of directors. The other piece of information I want to give to you and try and hopefully get some feedback over time is that there's a change in how members of our healthcare community are educated, the extent of their education. Traditionally, this organization was started by a group of practicing physicians in the community, and those are the voting members of this organization. So when an issue comes up, it needs a vote, it's approved by the board, and then comes to the general membership. So those are the originators of the organization. Those are the voting members. But one of our goals is to get as much of our healthcare provider system here together in one place for this period of time as possible. And so we're talking about restructuring the membership structure to fit the educational programs that are currently available. We had LPNs, and we had RNs, then we had master's degree nurse practitioners, and now it's a doctorate degree. Same is true with pharmacy, same is becoming true with physical therapy. So in our discussions, we used education as the categories. It's not that critical, but it does make a little bit of difference in how much we charge for membership. And as you all may or may not realize, membership is membership, and in theory, the conference is free. That's why we're also able to, if someone from the community sees a topic and wants to come and listen to a talk, they can do it. If somebody wants to walk in the door at lunchtime, pay $25 and listen to the speaker, they can do it. So your membership pays for your membership, and then that money pays for the conference, but technically the conference is free to anyone who wants to come to it. So this is how we look at the membership structure, or how we're looking at the membership structure at this point in time. And before the meeting's over, or in the next few weeks, as you run across the members of the board, give us a little feedback on that as we kind of work through that issue. And along with that, the other transition that's going to occur is that I retired this last year, and I really need to go fishing and skiing. So I'm going to be spending a little less time as chairman as I finish out my term. Mark Johnson, you'll see from the election, is now going to be the new chairman-elect, and during this next year or two, we're going to make a transition. So he'll become the chairman. We're going to then elect a new vice chairman, and that will probably be the vice chairman in the end prepares to become the chairman, but can also fill in for the chairman at any time he needs, and the vice chairman will be the person who's responsible to make sure that we operate by our ends policy method of governance. So that's all I have to report. So I'm going to ask Dave to come up and do the elections, and then Mark will go ahead and kind of pick up the meeting from there. Thank you.
Well, we're calling him coach.
I got you. Okay. Well, thanks, Bob. This has been a very good meeting, and particularly this morning, too. Thank you to the two speakers. Excellent job for information presented. So as chairman of the 2013 OSMS Nominating Committee, I, David Allen, present the following candidates that have accepted nomination to the Ogden Surgical Medical Society Board of Directors, 3-year term. So if I call your name, please stand. We recognize you, and stay standing. Dr. Douglas K. Anderson is nominated to continue as trustee. Let's see Dr. Anderson here. Dr. Heather Hylison, nominated for CME chair. Dr. Robert C. Mosinger is nominated for president-elect to be president of the OSMS in 2015. Dr. Brian Campbell has been nominated for secretary. And Dr. Mark Johnson has been nominated for a 1-year term to be co-chair, to be chair of the Ogden Surgical Medical Society in 2014. For all those who are in favor, please say yay or raise your hand. Yay. Okay. And any nays? Well, it's clear that the ayes have it, so very good. We'd like to welcome the new OSMS board members and on the board of directors.
Okay, we have just 2 more reports here, about 5 minutes each. First will be the treasurer report, and that will be from Frank Brown. And the second one will be from Heather Hylison, who is our CME chair. And then after that, we'll have Noel Nellis will be giving us a 10-minute presentation on the history of the society. So we'll start with Frank Brown.
I want to give you just a quick snapshot of where we are. I've covered a couple different topics, as you know, over these years. About 5 slides or so, if we can go through this. So this just gives you a snapshot of where we've been over the last few years, and a couple things I want to talk about there, if I can figure out where the pointer is. Yeah. So if you look at the exhibitor fee, the exhibitor amount that we've collected over the years, that did go up. Probably 10 years ago, there was no pharmacy support, and then we began soliciting that, and as you know, this pharmacy support is actually going away. And so a lot of those exhibitors you see out there are not paying, in part because it's part of this community involvement. So all the nonprofits, the health department, the medical corps, all those folks are here to be part of the community, to expose themselves to you guys, but they're not paying. And so that our exhibitor fees and the amount we've collected is going down. The big deal that Bob has pushed over these years is the sponsorship fee, and that's those darn slides you keep seeing before every one of the shows. The Ogden Clinic has supported us. We've got the Family Practice Academy on board, the Kidney Foundation on board, and all those kinds of donations. And you can see that's increased significantly and continues to increase in 2013. So that's a big deal. Bob has talked about that. Important for it to continue this organization. And then when Treese came on board, we started adding an annual fund, and so you'll get a mailing in the fall. And that's increased some of the donations here. And then Treese has been trained on obtaining grants and grant proposals and all that kind of stuff. So Treese is working on that, and we anticipate that we'll be able to get more in both from the annual fund, we hope, and then, of course, from grants. And then lastly is the dues, and the dues structure, we've increased the dues amount a bit, and then the big deal has been the increase in the number of folks, and I've got that on the next slide. So just graphically, for those of you who like to look at graphs, this is where we're at. But basically, income-wise, really doing very well. Look at this, for $106,000 in 2007 down all the way up to $185,000. Unfortunately, expenses increase, as you might suspect, and so going back over the last decade, so here we are at about $160,000. It kind of smoldered along here between $150,000 and pushing up to $200,000, and then these last 3 years, and this year is going to be somewhere under $250,000 to run the organization. Just a little bit of breakdown of that expense. Total expenses then, as I noted, 184 up to 224, 244 last year, and it's going to be about that this time. Look at the dues income, just transferring that same data here. But our number of attendees, look at that, going up 286, almost 400 again. We're over 400 for this meeting. So doing well in terms of the number of attendees that are coming in. Bob saying that the price is free because it's a membership fee and so forth. Well, here's the average cost, okay? I mean, simple math, just dividing the $394 into this, and you get about $620 per attendee, and you can see average cost per attendee right around $200. So that difference, the $400, has to be made up, and it's made up on those different income sources I described. Last year, in a couple years, people have said, you're bringing in all these darn speakers, and there's 40-some speakers this year. So how about bringing in fewer speakers, having them speak more frequently, and so forth? Here's the cost. So from 2010, 2011, and 2012, Teresa pointed out to the speakers, we are a nonprofit 501c3 organization. You could donate your speaking fee back to the organization. Look at what that's done. Okay, so most of our speakers, the vast majority, are donating their time. And those of you that know, what it costs to hire speakers and so forth, here's a big deal. I mean, these folks are giving back. This $21,000, $15,000 of that was one speaker last year. One of our noon hour speakers was $15,000. So the speakers are really, we have a lot of speakers. They've really been very supportive of the society. We have two different funds in the organization. One is a restricted fund that those of you involved in foundations know that you get donations from places and they say you can only use the fund to support a certain thing. You can't violate the principle of the trust and so forth. So there's a, whoops, how do I go back? Yeah. So we have this restricted fund right here. Okay, and then we have the trust fund. And the allocation of assets is a little bit different. So this is the restricted fund we want to protect a bit, so it's more in fixed income, and the trust fund we put more into equities. So if you look at the performance, going back to 2009, as you know, the market has seesawed a bit, okay, but this just ends back in 2012. That's our financial year end. Obviously, this year, we're probably up again, just like the market, 15 or 16% since in 2013. So we've been doing okay in that regard. So what's happened to the fund? It's been a seesaw just like all of our retirement plans, okay? So things peaked in 2000. We had this seesaw. We had a horrible year in 08. Despite trying to protect the darn thing, we lost 35% or something like that. And then, so we've been building back up, and this is where we are basically where we were in 2000. So just like a lot of you, we're back where we were when we started the millennium in 2000. So how much have we drawn out of that? Basically, obviously, that difference between what we've collected in income and then what do we raid from the endowment fund, and here are the figures. So somewhere between $80,000 here, and the last couple of years we've been $55,000, $60,000. So that's we have an endowment fund, and we have rules on how much we can take out of that. Typically, as you may know from your own retirement, if you take out 5% or less, that'll cover you with inflation and so forth over the years. So if you look at $1 million endowment, we've got $1.3 million, but $1 million endowment will give you $50,000 a year, and you can keep that going for a long time. So we've protected the endowment. It's increased, and I think we're doing okay in that regard. So my final slide is just to reiterate what I showed you initially, is that the exhibitors are a big deal, but they are going down. The sponsors are a huge component of what we're doing. We'll be applying for more grants and hopefully get some support from the annual fund, and we're trying to keep the dues and fees at a minimum at this point. So, any questions or concerns on the? Great, thank you.
Thanks, Frank. Just to reiterate one point Frank made, is the best way to increase yearly income for this conference is to increase membership. In other words, more people coming to the conference. We already have a good number of people, but always looking for more. So one of the concepts is to bring a friend and spread the word and bring more people from your clinic and your associates and so forth, because the more members we have, the more income we produce. Okay, our next is the CMA report. Heather?
Thanks, Dr. Johnson. I'll keep it brief just because I want to get back to those good topics. Many of you have contacted us to see how we get these lectures or how we get these topics. And the way we do that is we identify physician gaps or care provider educational needs in the community. And some of this is by filling out the backside of this nice salmon colored form that I see a number of you have on today. It must be in fashion. But the front side is the way you get CME, but the back side gives us information about what you want to see, how we can do what we do better. And then we take this information, other information we get together, as Bob mentioned, several times a year, and we discuss recent journal articles that we've read or speakers that we've heard, and some of this occurs on the backs of horses up at Driggs, Idaho, at Bob's house, and a couple other very fun activities that we do when we get together. And so if any of you are interested in joining the CME committee and becoming part of the planning organization of this meeting, you are more than welcome to. We would welcome anyone that wants to become involved. You can just contact me or Teresa or anyone on the board. But I just wanted to close and say that we are one of very few organizations in the state of Utah that have full commendation for the full 6 years, which is the maximum you can get, and that's up in 2016. So I think that speaks very well of the conference as well. And I just wanted to say what a pleasure it is that I'm able to serve on the UMA CME Committee Board and represent the Ogden Surgical Medical Society. So thank you.
All right, our last speaker for the